Economic Development, Homeland Security, and Senior Citizens now convenes this public hearing. Public hearing notices were provided. First notice on Monday, September 14, 2015, and second notice on Wednesday, September 16, 2015. For the record, today is Monday, September 21st, 2015. The time now is 9:05 a.m. The committee will hear Bill 166, which is an act to establish, for the purpose of reestablishing and funding the Banking Insurance Enforcement Fund, and thereby facilitating health insurance reform practices. Bill 167, it's an act to add a new subsections 103.121 and 103.122 to Chapter 103 of Title 11 to provide under Guam law the equivalent statutory application of Section 2794 rate review and Section 2718 medical loss ratio of the United States Public Health and Service Act as provided pursuant to the Patient Protection Affordable Care Act, and Bill 173, an act to repeal and reenact Chapter 17, Title 10, Guam Code Annotated relative to shelter, infrastructure, and employment services for the homeless. And at 2 p.m. today, the committee will have a confirmation hearing on the executive appointment of Dr. Nathaniel Berg as a member of the Guam Board of Medical Examiners, as well as the confirmation of Mr. Philip J. Flores as a public member of the Guam Board of Medical Examiners, and an informational hearing on the Guam Memorial Hospital Authority. I'd like to acknowledge Senator Brent McCreadie and Senator Mary Camacho Torres. Thank you very much. And to all of you for being here this morning. We'll start off by entertaining Bill 166-33. We have individuals here who have signed up but have provided written testimony. What Bill 166 does is it establishes the Insurance and Banking Enforcement Fund, which was established a few years ago, but was abolished. And so the intent of the Guam legislature is to repeal and reenact 103.120 of Chapter 103, Title 10, and to amend subsections 15.110 of Article 1, Chapter 15, Title 22, Guam Code Annotated, for the combined purposes of reestablishing and funding the Banking and Insurance Enforcement Fund. We did have indication by the Insurance Commissioner that they would be providing testimony, but I also would like to state for the record that we will have a markup on this bill before reporting it out, and invite the stakeholders who are here today, this morning, and who have signed up and have provided testimony, so you can rest assured of that. And so if there's no one else here that wishes to provide any oral testimony, then Bill 167 has been duly heard by this body. 166. Next on the agenda is Bill 167, which is an act to add a new subsections 103.121 and 103.122 to Chapter 10 of Title 10, Guam Code Annotated, to provide under Guam law the equivalent statutory application of rate review and medical loss ratio as provided pursuant to Patient Protection and Affordable Care Act. And we do have individuals who did sign up as well, who have provided written testimony. I'd like to ask them if any of them would like to provide any oral testimony. Okay, please. Mr. Frank Campillo, and any of those others who had signed up, if you'd like to, Mr. Crisostomo and Mr. Larson. Thank you. Okay, great. Thank you. Thank you very much, gentlemen, for being here this morning. What this bill does is establish two provisions of the Affordable Care Act that Guam was exempted from, which is the rate review, which basically ensures that if there is any increase in insurance premiums within a certain percentage, that it go through a rate review process. And that is, we've tasked the Insurance Commissioner to come up with the rules and regulations. Actually, and the federal government had also in the past provided funding for Guam to establish the rate review. Guam had actually applied and asked for federal government for funding to establish it. However, with this July 2014 letter from the federal government indicating that Guam, basically and territories, are exempt from this, it wasn't pursued. However, it's the intent of the body or of the legislation, at least, is to incorporate that in local statute and to be able to provide the safeguards for our consumers as well. The second component of this bill establishes the medical loss ratio, which again is meant to protect our consumers and also be able to take into consideration the administrative costs and the profits of the insurance companies by ensuring there is a percentage that is spent on direct claims, and also percentages that take into consideration the cost of managing the accounts, taxes, and other fees that are imposed on the insurance companies. I know that Guam joined other territories. Actually, my office was involved as well in petitioning the federal government in the past to exempt Guam from certain provisions of the Affordable Care Act. No way did we ask and request to exempt us from the medical loss ratio or the rate review provisions. It was basically the essential health benefits that we were very concerned about, that if the federal government pursued that it be adopted here on Guam, that rates would be unreasonably higher for our consumers. And so I just want to acknowledge the work that the committee has been doing together with our insurance industry partners, and we thank you for providing a great service in ensuring access to health care for our people. So this is where we have this bill in front of us. We've talked to some of you before this hearing, and that we feel that with certain amendments and basically, if not following exactly the way the federal government has laid out the medical loss ratio, the percentages, and the what is it called, the bigger, Frank, you can help me out here, what is it called, the large groups and the small groups, there's a different percentage. It's 80-20, and then I believe 85-15. And so, yeah, and that's the federal guidelines. But now we have an opportunity to do it locally and to have it really be able to take into consideration our unique needs, our unique location. And from there, still be able to protect our consumers, and still, of course, be able to take into consideration the cost that you guys undertake to service the accounts, and the profits that need to be made. We definitely realize that. So we're hoping that, again, after this hearing, we'll have a markup meeting to discuss any revisions, but it is the intention to move forward with this two important provisions of the Patient Protection and Affordable Care Act. So, Mr. Campillo, we can start with you. I know you started, you provided a written testimony, as well as Jerry, Mr. Crisostomo, and Mr. Larson, and we have that here, but if there's anything you'd like to add, then we'll go ahead and entertain that now.
Senator Rodriguez and members of the committee, thank you very much for the opportunity today. First of all, I'd like to indeed thank you for the work that the committee actually did in the past to make sure that CMS gave this waiver. I provided lengthy testimonies, about a 3-pager, and I know that we had discussions on the matter. If I can take you back a little bit, when I reviewed the work that the committee actually did before, the work that the mayors of the Marianas did, and more importantly, the study that was put together by the NAIC in regards to the territories, we realized that we had to oppose the way the bill is currently written. Okay, if you look at the cost for the insurance companies, and when you look at what is being out there in the marketplace, for instance, if you use government of Guam as a barometer as to what's going on in the marketplace, Guam actually has seen a decrease of health insurance premiums. Contrast that to what's going on in America today. In America today, and when I said America, continental United States, the opposite is going on. The marketplaces have seen increases as much as 75% in the last couple of years, because you're seeing consolidation of the insurance industry. And that consolidation is only done or is only the result of the fact that insurance companies got to realize economies of scale to be able to meet these administrative costs. Something that the committee may not know is that for this market and the ACA is not designed for small insurance companies. Clearly not. Add to that the new regulations that we have to follow, the anti-terrorism regulations in regards to financial disclosures and everything else, and it's become extremely expensive for the insurance industry to administer health plans today. That's the reason why you saw the big mergers between Cigna and Anthem and the rest of the insurance industry in the continental United States. So based on that, and all I'm asking the committee is not to undo the work that the committee and the people of Guam, the mayors of the Marianas, and many community leaders did in the past to get this waiver from CMS. And again, I provided written testimony, but that's a summary of what I provided.
Thank you very much, Frank. Frank, just to be clear, right, the work that the committee has done in the past and the mayors didn't ask the waiver to include the waiver exemption of the rate review or the medical loss ratio. It was certain other components of the Affordable Care Act that we saw problematic, that the federal government was really unfair to Guam. And so we just want to make it clear that that wasn't, these components weren't what we really wanted. That wasn't the ideal response we wanted from the federal government. As a matter of fact, Guam actually even applied for grants to establish a rate review process here. So the two components that we're trying to pursue are two very important components. You talked about the government of Guam insurance, where we see a decrease in premiums, which is very good. And I thank the three of you for participating in that process. The government of Guam agreement has MLR provision, which is
participating agreement,
which is similar to an MLR,
yeah.
and so we can take a look at it from that point. That really has strengthened the position of the government in ensuring that rates are competitive and reasonable, and that there's some sort of mechanism in place to ensure the MLR is there. So, just like I said, we will have a follow-up meeting and markups to really go through more of the concerns.
And for the purpose of transparency, you're
Yes.
correct, Senator. Yeah, the initial request that was made to CMS and the federal agencies in regards to changes to the law did not include those.
Yes.
And then, but subsequent, when you look at going back to what is going on in the continental United States, realistically, the ACA, the way it is currently written, and following up with the other financial requirements that are being put in place because of these new anti-terrorist laws and so forth, it's not necessarily something that is good for small companies. It does not promote competition. It actually is destroying competition, because you're seeing these huge mergers occurring throughout the industry. So all I'm asking the committee is to be mindful of that, that perhaps an avenue that we need to take is promote a greater number of individuals being insured on Guam and find a way to do that.
Yeah, and that's something where the committee is actively working on to ensure that we could increase the access to healthcare, but expanding the pool of insured as well. Great. So thank you very much, Mr. Campillo. Mr. Larson or Mr. Crisostomo, would you like to add anything?
Well, I would just add, Senator, that it would be unreasonable to pass legislation of reform without looking at holistically. And so my testimony focuses on what they're called as the 3 Rs, which are the reinsurance programs, the risk corridors, and the risk adjustment programs, which are part of the federal requirements. So if reform is to happen, several things need to be considered, not just requiring a medical loss ratio to be met. On a qualitative basis, any plan can spend consumers' money, and I think that's a point that maybe we're all kind of missing. It's not just simply spending 85 cents on every dollar for a large group, because there are plans nationally who have very low MLRs and produce excellent outcomes and have excellent programs like fraud, waste, and abuse programs, great care coordination programs, and medical management programs. And our argument would be that anybody can go and spend consumers' money on inappropriate health care. It's providing appropriate levels of health care. And I would argue that we know over 5 years what the ramifications of passing MLR is, and that is increased premiums with no reduction or no improvement in outcomes. And so I would just ask this committee to consider those arguments. Throughout my testimony, I make reference to, the small group market. I think it's also appropriate to point out that the small group and mid-large markets are very different. And to underwrite those markets and require a medical loss ratio, when in some cases you can't appropriately rate for the risk inherent because they're not providing certain demographic information or certain other information we rely on to rate, it would be inappropriate to require some of those factors in the risk factoring. And then finally, I would just say, 166, Bill 166 in my mind is predicated on the rate review that's contained in 167. You can't have appropriate rate review if you don't have the appropriate resources and tools to do that. And so you'll see in my testimony in 166 that we support the banking and insurance board setup, but we want to make sure that the appropriate oversight is given to that board and they have the resources. We do, however, object to the fees and the annual increases that are automatic in that bill. So, in summary, that's what I would have to add.
Thank you very much, Jeff. And so you're right. These are the companion legislations that in order to be able to have the proper oversight and to give the resources that are required of the insurance commissioner, that 166 was pursued as well. Again, thank you for your testimony. Look forward to working with you in the markup of this. Thank you. Mr. Crisostomo?
Thank you, Mr. Chairman. I'm Jerry Crisostomo, the Plan Administrator for NetCare Life and Health. I echo the sentiments by my colleagues here. And in addition to that, the 3 Rs, the support structure that is inherent in the federal law, but also the mandate to purchase insurance. And I think to make the MLR effective locally, you're going to have to include some of these mandates for individuals and employers to purchase insurance, as well as the subsidies to ensure insurance solvency. What happens if small companies, Medicare is the smallest player in this market. I think we have barely 10% of the market. So a law like this, I think, would be devastating for us. What happens if we exceed that required medical loss ratio? Is the government of Guam going to subsidize us for those unpredictable losses and those catastrophic losses that we would incur? He mentioned competition. Yeah, we would be completely out of the business, and our market share would go to the much larger companies. So if you're going to implement the MLR, like it's done in several states, they actually do it for companies that have more than 20 or 30% of the market. I have barely 10% of the market. If you take my self-funded business away, I have barely 6% of the market. So an MLR requirement like this, although for the past 3 or 4 years under the federal law, we've been meeting that MLR requirement, I think would be catastrophic for us as a small player. So if you're going to implement something like this, I think you need the support structure that's inherent in the federal law, the 3 Rs, and the mandate for individuals and employers to buy insurance, as well as stiff penalties for those that don't buy insurance. If we're going to mirror that, then mirror that all the way through. But as Jeff mentioned, I think if you're going to, we see this as piecemeal legislation, that if you're going to reform healthcare, let's bring all the stakeholders together, consumers, employers, providers, HR specialists, and insurance companies and consumers, so that we can eventually craft legislation and law that will be more appropriate for this market, and not necessarily the market in the U.S. mainland. Markets in the U.S. mainland are large. You have companies there that insure millions of consumers, as opposed to our small market here, where the largest carrier insures 30 or 40,000 people. So we're all small according to standards. But I think the MLR requirement, you see and you hear in the States horror stories of companies dropping coverage for people that are sick. They incur a lot of claims and they drop them. I don't think you see that or hear that in this market. We're a small community. If a company, if you give them a 30% increase, guess what? They go next door. If they don't like that increase, they go next door. They shop around. Every year, these companies shop around. And there's 4 carriers. Maybe there's 4 carriers too many, but consumers already have a choice. Consumers, I believe, are protected. If the intent of the legislation is under the guise of consumer protection, I believe our consumers here in Guam are well protected. The rate review, we're all required to submit policies and rate filings with the insurance commissioner. If he feels that rate filing is unreasonable, he'll reject that, and we go back to the drawing board. But if consumers have issues with their coverage, there's a mechanism already with the insurance commissioner, with the attorney general's office. If the group doesn't like it, they go to the next guy. And they've done that year after year after their anniversary. So I think here in Guam, we're a little bit different from most jurisdictions in the United States. We don't have the horror stories that you hear in California or elsewhere in the States. So I echo what my 2 colleagues have mentioned earlier, but I think we need to go back to the drawing board, bring the stakeholders all together, so that legislation, as comprehensive as it can be addressed, and not just this rate review, the MLR, and then what's next? Essential health benefits, and then what's next after that? But I think we need to look at what is appropriate for this market and pass a law that is appropriate for consumers, and all consumers, including insurance companies and providers.
Great. Thank you very much, Mr. Crisostomo, for that. Senator McCreadie, you have any? Senator Torres?
You mentioned the number of insured on Guam. What is the number of insured or primarily insured plans on Guam?
The number of members?
Because you're talking about markets.
Right.
You mentioned 30,000.
Well, one plan has 30 or 40,000. Both plans have 30, and we have about 11,000 members, so that's about 10% of the market.
What is the value of the insured on Guam? Like how many millions of dollars is paid into insurance? I'm just trying to
Oh, it's about
how-
probably about over 200 million. Yeah, it's about over 200 million. Yeah, collectively.
Yeah,
yes.
and collectively though, the market is about 90,000 individuals paying insurance.
90,000?
Yeah, so when you get 170,000 people, we got 55%, 58% of the market being insured. Yeah.
Okay. I'm just trying to get a gauge of what small versus mid versus large is.
But we're nothing compared to, the Aetnas, the Cignas, and these companies that they write $25 billion each, and in fact now for the new mergers, you're talking about $35, $40 billion each. So yeah, for these companies, 10% is a lot of money because you got 10% of $40 billion is a lot of money. For instance, a lot of people use that CMS manages to run their Medicare, Medicaid programs by only charging about 6% in administrative fees. But this is 6% of about $700 billion US dollars. I think we can probably do it lesser than that. So, and the point that we're making here is market reforms, and Senator, for the purpose of disclosure too, we discussed the 3 R's as well, because that is something that part of the ACA was to protect the insurance industry against catastrophic losses. Yes, we're going to make you comply with some minimum medical loss ratios, but at the same time, if things go south for you, the federal government created a reinsurance pool that pays back the insurance companies in case that things go south. You know, as Jerry alluded, on the other side, we don't have that here locally. And honestly, with the new rate increases, what is going on, GMH has alluded to rate increases. Our new hospital, the pharmaceutical increases that everybody has seen, I can guarantee you that when you look at the financial sheets of all 3 of us, that they're going a little bit south from where they were 3 years ago. So already you got market implications that are going to be very difficult for the insurance companies to meet in the future based on current trends.
I'm also trying to get a gauge of how many uninsured there are out there that could potentially fall into the insured category, i.e. those that are in the Medicaid MIP, medically indigent programs, because that also is a large percentage of the patient pool in our facilities. Isn't that correct?
And that is something that we've been trying. We have and have several discussions with Senator Rodriguez, because what we believe is the cure to the market is actually to expand coverage. In fact, the cure to GMH is exactly that. You know, have more people have health insurance rather than these individuals that do not pay. 50% of their receivables are because individuals cannot pay.
And that goes into the health maintenance type program as opposed to...
No, and that goes into the taxpayers of Guam subsidizing.
Right.
Yeah. So.
Correct. Yeah. Thank you very much.
Thank you, Senator Torres. Frank, and for Select Care and for Take Care, you're both in the federal program. So do you have a provision that you must follow with the MLR? And is there a reinsurance program that you currently have in those agreements?
Yes, absolutely. There is an MLR requirement in the federal government. It's 86%, so it's even higher. Correct, Arvin? 85, sorry. So it's 85%. Sorry, Gov Guam, I believe, is 86 in the requirement. So that does exist. And they also have mechanisms that if you have an excessive MLR, that you actually are compensated for that. So there is methods to reinsure, if you will, excessive risk. I think the other point I would just make, Senator, is there is a mechanism to actually start to fund some of these 3R programs, and at least 2 of the insurers on this panel today pay into a health insurance tax with absolutely no benefit to the island of Guam or its people. And frankly, if you diverted that money back to a reinsurance program or a risk pool, such as carving out some certain Medicaid or MIP individuals, you would inherently start with seed money to build a reinsurance program. And I think you would find several people in government sympathetic to the situation out here and would support that type of situation, because every other state is sharing in payment of this health insurance tax, and the territories are essentially paying and not getting any benefit from that.
That's right. Thank you for bringing that up, because that's an effort that my office also has been trying to get our congresswoman to address. Unfortunately, that can't be done by any of us here on Guam. It's a federal mandate that was imposed on the two largest providers. And you're right, that money, you're paying it. It's from your consumers who are here, but we don't see any of the benefits. And so that's something that we'll continue to pursue as well. Okay, so great. Thank you very much again for your testimony, and we'll definitely have a meeting markup to finalize this bill and see how we can move forward. Okay, thank you very much. We'll now move on to the next item on the agenda, which is Bill 173-33. Mr. Gillen from Public Health and Mr. Martin Benavente from Guam Housing. Now we have, I'd like to recognize Senator McCreadie as the sponsor of the legislation to give a brief summary of the bill. Senator?
Thank you very much, Mr. Chairman. Just to give a quick overview of the bill, Bill 17333 is an act to repeal and reenact Chapter 17, Title 10, Guam Code Annotated, and it's relative to shelter, infrastructure, and employment services for the homeless. There's going to be I just want to make sure that I reassure the stakeholders that we are working together with the administration and the executive branch. We will probably have some amendments for the bill. One of the first amendments would be, Mr. Chair, with your help, we have to remove the Safer Streets Fund, and I'm sure we can do that with a substitute version. But just so everyone is on the same page, this piece of legislation, if you look at the numbers, we have about 1,230 unsheltered homeless people. That's from the 2014 Guam homeless point in time count. And this is, as I said earlier, this is not a silver bullet that's going to save all of our problems, but we do have to work together and we do have to address this. And I was looking at some of the comments from yourself, Mr. Gillum, and you're right, overworked, understaffed. I do believe this could be a mechanism to alleviate some of that stress. Properly funded, properly manned, properly work together with all stakeholders. I think we can accomplish something. I just received a text from the administration saying that there are several options we have in front of us for funding sources, and of course we will utilize them. So whatever the governor's vision is, I'm hoping that we can marry the two visions together and come up with a bill that in the long term eliminates homelessness and make sure we give these people another option and a chance at life to succeed. So thank you very much, Mr. Chairman, for holding this public hearing, and I look for guidance and advice, and we'll work together. Thank you.
Thank you very much, Senator. Mr. Gillen?
Yes, thank you. Good morning, Senators. Okay, I'm sorry that this came a little bit late. I tried to get it to you earlier, but thank you for reading it so quickly. And you know, when I put down on the sign-in sheet whether I was in favor, I said yes, sort of. And a lot of it had to do with that, okay? The expectations, again, that public health is going to step up. And we are, stretched very thin. But that's, that's another matter. I think the other part of this is that this is a very complex phenomenon that 45 years ago I didn't even see. We didn't have it. Okay, you're too young. You don't remember that, Senator. But it just didn't exist. Okay, somehow we took care of our own. But now we have a more divergent and population, more diverse, and we've yet to really understand what we're dealing with there. Because I think that picture, I even heard somebody on one of the talk shows this morning depicting homeless people as just kind of drunk and shiftless and panhandling, and that's part of it, but that's not there are many people right now, maybe even in this room, that are probably a couple of paychecks away from being homeless. Okay, those are the folks that are probably the easiest ones to deal with if we can get them shelter and then get them jobs, because that's the key, is get employment. And we have I think Senator Sendiculas brought out the issue of the problem with our children being homeless, and again, it tugs at your heartstrings, and you want to do something, and we all want to do something for our kids. But if we just build the houses and we just build the shelters, we still haven't solved the biggest problem. I think Jeff Larson used his comment on outcomes. Okay, you can spend an awful lot of money on health insurance, and if people aren't getting better, you're just going to spend a lot of money on care, and you're not spending much money on making people well. And I think we have to do the same thing with the homeless situation. We don't, and there are any number of people in the community, I wish they were here. Because this, again, what the insurance people were talking about is we need a whole group of folks sitting down and taking a lot of time. We use the Lanny Kate task forces as the analogy. It took a long time. I remember working through the New Year's Eve holiday and Christmas holiday, trying to get some things hammered out. And that's starting to show some fruit, but it took, a couple of years. Because we all of us have a little bit of piece in this, okay, but we don't all have the whole picture, and we've got to get all together on this. We have a nice pilot project we think that's showing some promise right there next to the homeless shelter, Luma San Jose. We've got Gura to rehab 5 homes up there, and what we've done is we've taken families and put them in a home setting rather than just in the shelter setting. And then what we should have done, and we didn't do it completely, but what we did was we did some kind of one-stop efforts with those folks. Found out what they needed, whether they needed job training, whether they just lost a job, and how we could get them with their job skills into another job. So it took, and it's showing some promise, because some people are now out of those homes and actually are gainfully employed in their children. But we put them all together in a home. So mom, dad, if you had a dad there, and then the kids. When you're in the homeless shelter, you just thought, you're all kind of mashed in there, and it's short term. We need to have longer term solutions, because a lot of folks, when they come to us, have no skills. Okay, don't even have basic reading and writing skills. How are you going to get them employed? So there's a lot to do, and just throwing money. We spent $1.4 million, and we haven't even scratched the surface. And the challenge is going to be, okay, we can create the funds, but are we going to put them in the right place? Or is we going to say, like Jeff Larson said, we're going to spend a lot of money and we're still not going to improve the outcomes? So I commend you and Tony Ada for putting this thing forward. We need to work on it some more, because again, it really is a very complex issue, and it's not going to get solved just with this piece of legislation. Thank you.
Thank you very much, Mr. Gillen. Mr. Benavente.
Good morning, Mr. Chairman, Senator McCreadie, Senator Torres. Thank you for allowing us to put our 1 cent worth of advice into this bill. I commend you for introducing the bill, and I see it as maybe another way of solving our housing problems. But my presence here this morning, I want to instead invite you, Senator McCreadie, and the other senators that we've been almost like preaching to in the last 3 years. We introduced the bill in 2012 called the Housing Trust Fund. We funded it partially through Guam Housing Funds. We had his cheated funds put into it to provide for first-time homeowners. We can talk about solutions and go on, but we need to find out what the problem is first. And we've been studying this for several years now on where it's at. And when people say homeless, right away the picture that comes up to mind is these people that are running around in the streets of Agana and Tumon and Tamuning and places like that. I heard that this morning on the radio also, that's who they consider homeless. In the last few years, we've funded close to 300 families, assisted them in down payment assistance programs so that we can get them into a home. They were what we call the hidden homeless, who were couples that got married, but instead of moving out somewhere, they stayed at home in a one-bedroom, started raising their families. Over close to 300 of these families are now with a home, because we assisted them. The government assisted them to build these homes and make it their place. In the past, Jim has mentioned the 5 homes that Gura renovated under the what is that committee called? the governor created a committee to do the affordable housing program and asked me to chair that, the affordable housing council. Under that, we went back and found 20, 30 homes that belong to the government, buildings that belong to the government, and had them renovated with GURA funds, and are now in place. 5 of them been given over to the Guma San Jose and Derido, and like Jim says, that seems to be working pretty well. We have in our inventory about 150 some units that are, some are in good shape, a lot of it is in bad shape, 50-year-old Kaiser homes, and those we've been trying to renovate with whatever funds we had. We haven't been that successful with that yet, but we've been doing, we're probably able to do like maybe 3 or 4 a year, maybe less in the coming years if we don't do anything. We have I mentioned the Housing Trust Fund, and then I mentioned the Down Payment Assistance Program. The Down Payment Assistance Program is not a new program. It started many years ago, but it fell because it came to an end because of funding problems. We weren't able to sustain that funding that was there. So through the late Senator Ben Pangalina's leadership, we tried to fund it again. The speaker came in with a lot of you and took money out of what they call is cheated funds. So we managed to fund these new over close to 300 families. We managed to fund their down payment assistance, and we're close to running out of that money again, because I guess the program was very successful, and people are coming in left and right, asking for it, qualifying for it, and so forth. But when you look at homelessness, you look at those people that start with the people that are out on the streets, on the beach, doing nothing, earning nothing, stealing, sometimes doing other illegal activities. That's the bottom of the totem pole. We have a program that we've been trying to develop where we can find a place for these people to go to at night and shower and shave and return to doing the same thing the next day, but at least as humans. If you keep too many of these people out on the streets, they're going to turn to animals, and we don't want that. So you find a place for them. The solution might be just overnight housing, and that's all it is. But we need to do something about that. Then you go up the next level, and you got these people that are in need of homes but have nothing to start with and can't get a loan, can't get anything else. So where do they go? They go and rent units. What we've done to the rental industry in the past couple of years is just phenomenal. You see the brand new houses that are or apartments that were being built to accommodate these people who are in the $500, $600 level, and they're in those units now. You've got the Manamcos in the Ladder project that we converted into a Manamco center, the townhome they call it now. These Manamcos are able to avail themselves of a 1-bedroom apartment, somewhere around $500 and some dollars, or a 2-bedroom apartment for $600 and some dollars. Those are the programs that we need to continue. We've got many more different ideas that are being tossed around. What we need to do, the problem besides homelessness, is funding, is a permanent funding that can continue to keep these people out of the streets, continue to provide new families with a way to get their own home, continue to get these families into apartment rentals, because not everybody can buy a house. So until they do, they need to have a place to call their home. GURA handles quite a bit of that load already through their housing, the low-income housing programs, projects, and through their Section 8 program. But the ones that we concern ourselves with right now is the ones that fall over the cup, the overflow. What do we do with them? They're qualified to be Section 8 recipients, but the funds are out. So we're proposing that we come up with something like a local Section 8 program. Do you remember a few years ago when the sequester money from the federal government almost hit us? And they said that if to prepare the landlords to accept the fact that these people aren't going to be paying for their rent. What would have happened if 1,700 people, families, hit the streets? Imagine that. We don't have a program locally to handle that. And that's what we're trying to say, is that before we start telling the federal government what to do, what not to do, we need to clean up our act here and do what we can do, because Kafguam is a very mature government at this time. We can do things that other governments have done and other governments couldn't do. So we need to start looking at that. And our approach right now is being looked at for many years, and other territories, other states have already introduced and are recipients of what comes out of the housing trust fund that they have developed. And it's just, you couldn't imagine what comes out of that. The programs that you mentioned, Senator McCreadie, can be covered out of that. And the good thing about this is that it goes right back to the system where it says, okay, so we've developed X number of dollars under the housing trust fund. Now the legislature goes back and says, I have a program that will take care of the St. Nicholas concern where the kids are housed. I have a program that can do that. So let's fund it. We'll talk about it again, get the best way, learn the best way that we can to house these kids. Of course, they come with families. So that's one program. Then you have another program on how to handle the kids, the people on the street. So you come up with another bill. You say, we want to introduce a bill that takes care of those people out in the streets. Based on the best we know, we're going to introduce a bill to do that. And a lot of you, this is not a new thing, because starting in 2012, we were visiting almost all of you, 100%. We've talked to about the Housing Trust Fund. And I'm not saying that your idea would not work. I'm saying that if we put it together and make it more comprehensive, where everybody has put their 2 cents in, I think it will work better. And that's my testimony today, is just to ask you to help us put this in one package, where it doesn't go to Jim and Public Health, who has his hands full already with so many things, but it goes to a housing agency that has a mechanism to make these things happen. The other agencies, the nonprofit groups that are here, are being funded by federal funds. They're not just popping out of the private sector. These are federally funded grants that these people receive. So either way you look at it, government is involved. At this point, should be involved. We have, when the typhoon, I just want to mention one more thing. When the typhoon happened here a few months ago, the shelters filled up very fast. And the reason why it filled up very fast, because a lot of these people were living in tents, canopies, lean-tos, out in the boonies. And most of them didn't own the property that they were sitting on. So you couldn't give them a loan to build a house on property that didn't belong to them anyways. So what do you do with these people? We talked to, and a lot of them are from the FSM or FAS government. We have communicated with that government through its consulate office here in Guam, and we've told them about the problem. We've offered them a solution on what they can do for their citizens that are here in Guam. I have not yet to receive a reply on that. I've sent a follow-up letter, and I'm awaiting the results of that. But the FAS government is capable of taking care of a lot of the people that they have here that have not assimilated into the community. And some of them have a harder time assimilating because they don't speak English, and many other detriments keeps them from doing this. So there is also a solution brewing for that. So we'll see what that comes up with. So, but I ask that everybody that wants to do something in housing, call a more comprehensive group together and let's talk about it more and let's see what we can come up with. But in the meantime, I invite you to join us in the funding of the Housing Trust Fund. Thank you so much.
Thank you very much, sir. Clyde or Caesar, you have anything? Okay, great. Senator McCreadie.
Thank you, guys. You know, it's funny. I just leaned over to the chairman and asked, we didn't have to bifurcate all of these bills that he was talking about. We could put it all in one bill, and you just alluded to that. That's exactly, we're on the same page. Your consistent or permanent funding source, that's exactly what we introduced the bill for. Because right now there's kind of a gentleman's agreement, if you would, an executive order to the agencies kind of working together to get the job training, whether it's emergency shelters or transitional shelters. This is something that when we're no longer here, will still be a mandate. And it's something that I think is long lasting. I mean, if you take the problems that Hawaii has with homelessness, it's a great measuring stick to say we don't want to be like that. Right now we see the numbers at 1230. I don't want the numbers to be 3,000 in 4 years and then 10,000 in 20 years. We can stop it now. We know the problem. We know the solution. The solution is we have to work together. Yeah, that's absolute. So I think we have a very good working relationship with the chairman. I think that with your ideas, your concerns, if we can work with the administration, come up with a comprehensive, as I said in the beginning of my testimony, that the language in this bill would probably be changed. This is a starting point. I think it's a good starting point. But I think we need something permanent, and we'll work together. We will. And I've worked with you and you, sir, for many years now. So we'll keep working together, and we'll come up with a bill that addresses your concerns to make sure that it has long-lasting positive effects on our community, our law enforcement community as well, and our homeless people. So thank you very much.
Thank you, Senator Torres. No questions. Okay. So what we'll do is we'll work with Senator McCreadie, the author, and perhaps have a markup and additional meetings with other stakeholders, because I really wanted Department of Labor to be here as well, because when was one thing to ensure we have the roofs over their heads, but the sustainability is the problem. And when we see it, we see people come in and out, and the fact of the matter is, and the data shows it. Some of these our homeless population have, records in the past that really give them a hard time to get jobs, and I for one believe everyone deserves a second, third, fourth chance in life, but the fact of the matter is employers look at their court and police clearances and base their hiring practices on that. So we got to figure out a way to overcome that and see how we can really address that matter, because I think having them a roof over their head is one, but having them be able to sustain themselves moving forward is another, and that requires them making a living. So we'll definitely work with the committee, with the senator.
I just had one more question. Thank you, Mr. Chair. Mr. Benavente, you touched on the overflow and the families who qualify for the housing, not the shelter, the housing. My question was, is that overflow, is that a reflective of the 1,230 number that we have unsheltered, or is the overflow different?
I think it's a little bit of everything.
Okay.
You have FAS citizens in there in that overflow.
Okay.
You have some local citizens, and I wanted to touch on that when you said something, Senator Rodriguez. But some of that, whenever federal programs come out, they come out with these rules, and they say if you do this, you've had drug crimes or any other crimes, you don't qualify for Section 8, period. And if we feel in Guam that it's important to do something about it, that's when we need to jump in and say, let's create a local program that does allow these people that first, second, third chances. So that's where I'm at. That's what I'm talking about.
So are we going? Would you say that when we talk about homeless and trying to mitigate the problem? Or are we talking about the 1,230 that's in the point in time report, or is there another? Because
No, it's the same.
they're all the same.
Yeah, Gura makes that count, but they also miss quite a few that are out there.
This is a quick 1 day count, right?
Yeah,
Okay.
but basically they've done it before many times, so they know where they're at. They know
All right.
where people are at, and they can count them.
Okay.
But the biggest majority are coming from the FAS government. These people are coming in from those islands, and in the past, when we have immigration, the Vietnamese, the Burmese, and people like that, we kept them in a control area and not let them out until we figure out who they are, what they can do. But in the area of the islands, we put them on a United Continental jet. They land at the airport, and then from there, they don't know where to go, what to do.
So they just
So they just come out, and sometimes some of them end up in an apartment with other families. Some of them end up in the boonies with a canopy, and that's all they got. And they continue to do that. They continue to strain the infrastructure that's out there. And, we've got places like Gil Breeze and Gil Baza who still don't have water and power and stuff like that, the basic stuff. So we need to cure that also. Otherwise, those people, and there's about 100 families in Gil Breeze that are up there in lean-tos and concrete and anything you can find that are living there. But Waterworks refuses to go up there and service these people. We got them water halfway up the hill. And they get water from there. The mayor somehow pays for that water. And that's all the good water that they get. And
So-
besides catchment.
Can I just expand on your statement? Because you said in some cases they land, currently they land and go straight to either an unsheltered homeless definition or some kind of welfare, right? When that happens, do they jeopardize the program for others who may need it as well?
Well, I don't know if you want to use the word jeopardize, but if you got a long line, the line just got longer.
Yeah.
And it goes in Jim's department too for food stamps, and Gura, because these people come here and they already know where to go, what they need to do to qualify, and so forth.
So they have a plan, basically.
They have a plan, but sometimes that evening that they land at the airport, they have nowhere to go. So a lot of them just go wherever it takes them.
Do you guys ever research on how they afforded the plane ticket to get here? Is it something that they are paying for themselves, or are their governments paying for it?
I think they're
Do we ever
paying.
have those situations? Do we know?
I think that I don't know for a fact, but I think that most of them are paying it for themselves. Maybe some of them getting rid of their properties that are over there.
Oh, okay.
And that's where we asked the FAS government to come in, because on the compact we believe that they're getting funds from the U.S. government, but what do you do with those funds when all the people are gone? So
I do
we're
believe there's a big bank account for the
inviting them to
FAS.
come back to Guam and invest in some units here so that they can house their citizens that are overflow, that have not been able to assimilate, not been able to get an apartment, or those that have been kicked out of several apartments because they can't continue to pay. So they need to own some of these responsibilities.
And how is your
also.
dialogue with them?
I wrote them a letter. I run them to him in the
No response.
elevator. And that's about it.
But so they're not
But no, in fairness though, I think the speaker came here and contributed 100,000 after the storm or something like that, and to help their people. But
our last storm.
they're they are concerned, but maybe they just need help and guidance and how to help, and that's what we're offering them. Guam Housing and the governor, of course, has directed me to do all these things. So.
Thank you.
Thank you very much. So it's 10:04. We'll recess this hearing. until 2 p.m., where we'll pick up the confirmations to the Guam Board of Medical Examiners and the hearing on GMH. Thank you.